All right. Now we get to the woman who fell in love with her psychiatrist over telehealth sessions, 30-minute long telehealth sessions. This is what's been popping on TikTok. And I wanted to tackle this and see what the fuck is up here.
Well, hey y'all, welcome to Rachel Reed TV, and thank you for being here and tuning in to more. Welcome,
psychiatrist enough to.
now let's get into the video.
I fell in love with my psychiatrist, and he knew that, and he kept me for years as a patient until I was brave enough to leave him. I want to talk about it. Usually when I go on this app and I have a question, I have a bunch of videos that pop up, and I searched in love with my psychiatrist and nothing happened. So I would really like to discuss what happens when we fall in love with our mental health professionals, and most importantly, the fact that there are so many people, especially men, that are emotionally dead inside, that feel called to going into psychiatry and therapy so they don't have to feel their feelings, but they can feed off of the vulnerability of their mostly female patients.
Okay, I'm confused. People immediately hit men. Are we... is this like are we automatically assuming that the dude, the fucking like licensed therapist, was actually grooming this lady, or what are we? I don't know anything about this, but I was just off the jump. I feel like this is, he knew that I was in love with him, but he kept me anyway, is like, that's a bit of a bold claim, because the claim you're making is like medical malpractice. And I don't know if that's, I'm not going to immediately assume that that's exactly what took place here,
What do you guys think? I fell in love with my psychiatrist, and he knew, and he kept me until I had the strength to leave after 4 years. Here it is, part 1. So I decided to go back on ADHD meds after many years of being off of them. I was on them in my early 20s to help me get through college, and then I went off of them because they just weren't, like, the side effects were too much over the benefits. But then in my late 20s, I read this book, Taking Charge of Adult ADHD, and it absolutely changed my life. For my fellow ADHDers, there's so many good things in here. And the biggest thing that I took away was that it's very important for ADHDers to be on meds. So I decided to make an appointment with a psychiatrist. I just Googled psychiatry in the city that I lived in, and I went with the first one that came up, and I got an appointment within a month. And then I booked a 90-minute intake, and I show up to the intake, and this man is my age, and I can't help but notice that he's pretty attractive.
Okay. Okay. Flag on the play. First red flag. Okay. Red flag alert. Red flag. I mean, the first red flag I didn't want to say because it was going to come across as inappropriate, but like, she does have the kooky lady glasses on. Okay. But I didn't want to say it because I was like, I don't want to, like, shit on like a victim or something. Okay. And then the second red flag was there's like something a little off about it. I mean, she is doing a 50-part series on this. But now she's like, well, I'm gonna keep it $150. He's fucking hot. Like, my therapist was attractive.
This psychiatrist. I fell in love with my psychiatrist and he kept me anyway, part 2. So in this intake, you know, I kind of clocked that he was attractive in my age, but when I tell you that I've had a lot of couch time in my life, a lot of therapy, you know, I just went right into it. I trusted him enough, of course, why wouldn't I, to tell him about my childhood trauma, my daddy issues, if you will, what I had went through, all of the relationship trauma that I had. I was 6 months sober at this time, but like all of the drinking and substance use I used to do, and he just listened and nodded. And that's the thing about psychiatrists, is that they're good at pretending to listen. They can appear connected, but that doesn't mean that they're always connected. So I just felt really seen. And I also told him, I was like, look, I don't want to be on stimulant meds. So he listened to me and he put me on the non-stimulant ADHD med at the lowest dose just to figure out if it was going to work for me. I was in love with my psychiatrist and he kept me anyway, part 3. So I hadn't ever seen a psychiatrist before. When I was on meds in my early 20s, I only got meds from my primary care physician. So I didn't understand how psychiatry works. So because he was figuring out my med dose, I saw him every month and he just made me feel like I was his friend. He was really, really funny and cracked jokes.
No, that's what? Like, that's not a red flag on the psychiatrist. That's a red flag on you. That's like the job of the what? He was like listening to all my concerns. I fell in love with my psychiatrist. He was listening to all of my concerns like a friend. It's really fucked up. Really messed up how I just kept telling him on and on about everything that was going on in my life. And he just kept listening intently. Like it was his job or something. Like he literally was listening to me like it was his fucking job.
And told me he was impressed with my running that I would do. And yeah, so of course I loved the attention that I got from him. And it was in my 3rd session with him, because at this point we were all on Zoom, that I asked him, I said, hey, do you mind if I call you by your first name? And he's Pakistani, so I said his first name wrong. And he said, well, it's pronounced this, but yes, of course you can. And he seemed so smug and happy with himself. And I know that is because that was his first sign that him pretending like we're friends was working. And to be fair to me, I had only ever been to therapy before. I didn't realize that, you know, it's important to call your doctor last name. I mean, I did know that. I did it with all my other doctors, but it just showed that the boundaries were blurring, and he liked that. So from then on, from my 3rd session on, I started...
Okay, you're making these inferences. You know what I mean? Like, what the fuck? Wait. I'm gonna be honest. I know I make this point a lot, but the bar is so fucking low for dudes. We still failed to clear it. But like, this woman literally fell in love with a dude who listened to her professionally and was on time. Okay? That's it. Like, he was there when he had to be, and he just listened. That's it. He didn't do anything extra so far.
Calling him his first name. And then he just started turning up the volume on us being friendly. And he would ask me for the first...
Conveniently ignoring the fact that she thought he was hot on day one. Sure. Okay.
For 6 sessions, he asked me after the meds, he said, how's your bowels, bladder, and appetite? And I would say they're all normal. And then he would ask me any thoughts of harm. And apparently that's pretty common for psychiatry.
Yeah. Wait, what?
To ask those questions. And then on our 6th session, when things were really, the chemistry was starting to be there before, like, I didn't realize it. I was like, oh, this man is just friendly. And he said, I have to ask this because it's a special interest of mine, but is there any thoughts of harm? Like, I was special to him. And I said,
what? Yo, what do you do when someone is already doing therapy? What do you, because like under normal circumstances, if someone was like telling me this, I'd be like, you have to go to therapy. But she's already having these wild thoughts in therapy. So okay.
No thoughts of harm. And he didn't ever ask me a clinical question again. He stopped asking me about my bladder, bowels, and appetite, and he stopped asking me about thoughts of harm. So to me, I would just show up and he was like a therapy appointment every month.
So I was seeing him every month and just gaining more and more respect for him because he would just tell me these little things about his successes and all of the cool things that he was doing in his life. And it made me fall for him, honestly. And he was really good at listening. And I mean, he's a Pisces, right? So of course he's going to be there. And
no, it's because that's his job. Did I misunderstand? Because if she was describing this about like if she was describing this about, I don't know, the plumber, I'd be like, yeah, the plumber is throwing work your way, lady. Throw it back for the plumber. Okay? But it's crazy to say that about your psychiatrist. That's his fucking job. You're paying him. What? The plumber is Capricorn. Patients wanting to pursue relationships with their therapist isn't actually uncommon. It's a problem. It's pretty much always recommended that the therapist refers the patient to a different therapist. Yeah. People were saying in the chat, we got a lot of psych majors and maybe even some therapists in the chat. They were saying, is it called transference? Is that what it is? I don't know. Yeah, it's called season 1 of The Sopranos.
and be able to go deep with my feelings, but that doesn't mean that he wasn't extracting from them. Anyway, so I would beg him to let me see him every week. Beg him, because my therapist at the time, he was fine. You know, he wasn't a predator, but he was fine. He just wasn't doing very much for me. And so...
Yeah, okay. This is like red flag number 7 million. So she was already going to therapy with another therapist, but the other therapist wasn't, you know, she wasn't into the other therapist. So she was using her psychiatrist probably even more than she's supposed to see him for refilling her prescription, but she was using the session that she had with this dude, a telehealth session that she had with this dude as almost therapy. But it wasn't even therapy, really. It was more so she was trying to fuck this guy. Yo, so I Googled a therapist and have been falling in love with this guy for months. Turns out he started his Craigslist therapy business just before he took me on as a client. What?
That therapist retired and I got a new therapist. And this new therapist, who is a 75-year-old woman with a PhD, she was pretty helpful. So I stopped asking my psychiatrist, begging, honestly, to be my therapist and let me see him more, right? Which also should have been a red flag. But then I started focusing on this therapist. However, I would tell the therapist how obsessed I was with my psychiatrist, and she didn't do anything about it. She just was interested. She also loved stories about my dating life, and yeah.
Bro, she has smoke for every medical professional that's been around her. Like, what the fuck? She got the attitude of like, everyone's out to get me. She got the everyone's out to get me type attitude, you know what I'm saying? Where it's like, oh, all of these licensed medical professionals were just like really interested in my life. and they were wrong. They weren't like trying to do their job or anything. They were just like prying. Isn't that their job? Isn't that the job of your therapist? Like to pry? Am I wrong? I don't know. There's probably some people in the chat who are going to be like, Hassan, you're being quite ableist here. But like, your job is to grift. You do well. Why are you falling for this and making a thing when it's fake? Why propagate this bullshit when we have enough right-wing bullshit? Hassan is a grifter, and you're all as brain dead as the people who watch 5 on the Fox. First of all, we are the people who watch 5 on the Fox. Or 5 on Fox. So we're double brain dead. Chatter. Your job is a grift. You do it well. I'm a grift engineer. He said, yup. You're on Twitch, man. Go tune into another fucking broadcast. See what they're doing. You know what I mean? You're on fucking Twitch. I've been live for 6 hours. First 30 minutes, I get into like some TikTok trend that's going on that's like going viral. Some people try to have fun on Twitch. You just grift. Oh, well, okay. Well, go have fun somewhere else. Motherfuckers would be like, dude, what? You're so stupid, dude. You're fucking grifting, dude. Okay. Well, go somewhere where they're not grifting, I guess. Go watch Asmongold. I'm an engineer of grifting.
She also was getting supply from me in her own way, but that's for another part. So yeah, so I got a new therapist who actually helped me. She taught me CBT, EFT, all of these different modalities. And so I went back to just being okay with seeing Irfan once a month while he was giving me these little breadcrumbs of making me feel special, telling me about his professional achievements, telling me about how he's getting international recognition. And it worked. I was really impressed. I got a new therapist. I stopped begging my psychiatrist to see me weekly. And that is when the intermittent reinforcement started. Some sessions he'd be warm and kind and wonderful and let me in on little parts of his life and like be vulnerable with me or pretend. Other sessions, he would be cold and clinical and detached. And you know what that did? It made me work harder in our next sessions. It did. And it started the addiction that I had to him. 100%. And he knew exactly what he was doing. This man gives lectures on trauma and attachment theory. He used his psychiatric training to manipulate me and get me hooked. And guess what? It worked. In January...
I don't get it. Like, why doesn't she just lie? How do people listen to this story and ask for his name as if he's done anything wrong up to this point? Because, like, so far we're on, like, part 6 or something. And she is just lying. No, I don't even think she's lying. Like, I think this is just her own twisted mind making a mountain out of a molehill. Like, she's almost brutally honest and just kind of delusional, if that makes sense. You know what I mean? It's just, she's basically saying my perception of this thing that didn't happen actually is the correct interpretation of events. And she's not even like it's more so just an embarrassing thing for her, really, so far, rather than just straight up, I don't know, making shit up about this like fake therapy session. You know what I mean? Still got an hour, buddy.
January of 2024, I was hit by a car turning left as I was going through a green light. And it was the night before my appointment, my next appointment with my psychiatrist. So I was like, okay, I'll still be able to go to my appointment on Zoom. I'm okay. But I did make an appointment with an urgent care the next day just to get checked out. I had bruising on my abdomen and a perforated eardrum. And the provider at the urgent care said, I do not feel comfortable treating you. You need to seek emergency care now. You may be internally bleeding. But it was 11 o'clock in the morning and my appointment with my psychiatrist was at 2. So I decided that I was going to wait so I could see my psychiatrist and not have to reschedule because I was looking forward to my appointment with him so much. I look back at that time and I'm just like, oh my God, I put my own life under seeing him. I was fully addicted to him at this point. And you know what happened is that I showed up and I told him that I may be internally bleeding and he didn't stop the appointment. He didn't say, you need to take care of yourself, go get emergency care now. He let me continue and just tell him about how much I loved him and how grateful I was for him. Because that was really what most of our appointments were, is me just like pouring myself out because he was so good at the intermittent reinforcement. Yeah, I got some warmth from. So that was January 2023. And I also told my therapist about this. She said nothing. After I risked my life to see him.
Okay, that also, see, this is what I mean. 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 Right as you're about to get to a point where you're like, maybe the guy's fucked up, she just ruins her own point by being like, and I told my other therapist about this, and she basically said it was nothing, implying that not one, but two licensed professional people who are offering her medical help basically just were like, yeah, it's fine. You're a little, it's all good. Unless they were in cahoots. I guess she had the worst luck with therapists, I think. A lot of women are not believed in the medical industry. Oh my God. This is why I always find it dangerous to watch shit like this. Because sometimes there's always a fucking long-term community subscriber that goes, no, I'm just the exact same kind of crazy as this person is. And you're a fucking piece of shit. It's like, what you're describing is not wrong. You're just slamming it into a situation that where it doesn't fit. I'm still on the fence, to be clear. Okay, dude. It's kind of funny because like she's not even doing a good job, I think, presenting herself as like a pure victim in this situation. Like, I don't know. I feel like she's just like, when I first came in, I didn't think I was gonna possibly side with the faceless, lifeless, possible psychiatrist that's like, I guess, kind of giving her therapy. Even though he is he's just prescribing her and re-prescribing her medication. I'm telling you, the psychiatrist is ChatGPT. It has to be.
him, that's when he really started turning up the intimacy in our appointments. However, he was really smart and knew the professional lines like the back of his hand. So he would comment on my appearance, but not compliment my appearance. So I would come on screen and he would say, "Oh, you curled your hair." Or I would come on screen and he would say, "Oh, you're wearing glasses." And of course I felt seen and excited that he was noticing these things about me.
Bro, do you see what I mean? Like, she could have just lied there. We wouldn't know. We don't know who the fucking psychiatrist is. She could have just been like, he kept flirting with me. Instead, she's like, he was doing small talk and I took it as flirtation. Do you understand what I'm saying? Like, she is not making a convincing case for herself. Like, it's just very difficult for me to look at this situation and be like how are you such an unreliable narrator of your own story that, like, when you're describing your victimhood, we don't even know the other side, and it's like you're still doing such a bad job that you're like, that doesn't seem like anything crazy. Like, that doesn't seem like something fucked up happened there. It seems like that was just small talk. I don't know.
I didn't realize at this time that he had feelings for me too. I thought I was holding them all by myself. So I was so excited when he noticed my glasses that I ran and showed him my other pair. And he said, "I prefer turtle shell glasses." So even though I usually wear contacts, I'm wearing these turtle shell glasses in these videos because just in case he sees them ever, he'll see me in his favorite glasses. He did tell me he likes the turtle shell. Anyway, it was just inappropriate things like that. Little.
How do I get a woman to think of me this way? What the fuck? Bro, you do not want this, chatter. Are you out of your fucking mind? It's just, yeah, be a Pisces, chatter.
Teeny things that he let me in. And all this time, my best friend is an emergency medicine physician. And she told me, she said, "Kendra, one of these days, your psychiatrist," she would use his name, "is going to say, 'I can't be your doctor anymore. I want to be with you. I want to be with you so bad. I can't be your doctor. I'll see you in 2."
Oh my God. Oh my God. You have an enabler.
Years. So my best friend, who's a doctor, she picks up on stuff like that. So even she knew that our relationship was crossing boundaries and getting weird. But that became my dream, was for my psychiatrist. I almost do the same.
If only she was racist. Perfect woman. The black Chad. Y'all are fucking stupid, dude. Actually.
To do that. And I told him about Brianna saying that, my best friend, who's the emergency medical doc. I told him that she would tell me that, and he just would be silent. He didn't disagree, but he didn't agree. And that was weaponized.
Okay, from this point on, he should have just been like, dude, okay, you need a different therapist. Like, that's crazy. Like, even outside of the ethical violation here, okay, as a licensed medical professional, it's also fucking annoying. Why would you want to deal with that? I guess maybe because he's like not a therapist and he's just like, whatever, I'm just fucking signing off your goddamn medication and you just chirp at me for like 10 minutes or 30 minutes. So he just didn't think about it at all. I don't know. Because like ultimately, patient ding ding ding, patient abandonment, dink doink, patient abandonment. It's BetterHelp. She's so insane. I love her. Yeah, just put the Adderall in the bag, little bro.
Neutrality was his favorite game to play, right? He didn't disagree with Brianna telling me that my psychiatrist had feelings for me, but he also didn't say that's inappropriate. Let's change the subject. It was also around this time that I asked my psychiatrist if he had diagnosed me with anything other than ADHD when I had my initial diagnosis. And he said, yeah, I did. I said, oh, what did you diagnose me with? And he said,
a therapist. Neutrality is his favorite game to play.
well, you had a lot of traumatic things happen to you in childhood because of your dad. And so I diagnosed you with other trauma and stressor related disorder. And that was the first little ping that I got of like, that was weird. Why would he keep that from me? I asked him, like, why wouldn't he tell me that? That seems important. He didn't tell me because he was using that information to manipulate me. He knew I had trauma and stressor disorder, and instead of helping me heal from it and telling me about it, he used it against me. January 2023, at this point, I was
What? I diagnosed you with being the love of my life. Dude, the big reveal is the ChatGPT is the therapist is crazy. The big reveal in all of this is that it's actually just a chatbot that she fell in love with and is making it everybody else's problem.
was full-blown obsessed with my psychiatrist, and my therapist wasn't helping me, my psychiatrist wasn't helping me, he was feeding it. And then I got a boyfriend, and at first my psychiatrist wasn't really that keen, but then my psychiatrist realized that my boyfriend was a lot like my psychiatrist. And then I started talking to my psychiatrist about my sex life, about tracking my cycle, using the fertility awareness method. And my psychiatrist loved it. He didn't never say, this isn't inappropriate to your care, let's pivot. Oh, he just let me talk and talk and talk about my sex life. And I didn't get too deep, but about a year and a half in, and I would send my psychiatrist these emails just about how much I liked him and how I was so grateful for him and put in a bunch of heart emoji.
Okay, now I know this psychiatrist was bad. This woman has so much more going on than what he diagnosed her with. Another thing that I also noticed is that the only party that's like throwing stuff in this direction, by her own admission, is her. The psychiatrist never does anything. Like, this is part 7. We're 60 minutes in. I've yet to see one thing that he has done that even remotely entertains her delusions. He's just not engaging. I feel like he's like, my job is to prescribe you your medication. And also, I need to know if you're, if you're healthy. As this is a part of my job, which includes like, normal cycles and things of that nature. Listen to women. Yeah, bro. Turns out that's also problematic. Okay. Maybe you can listen too intently and then, oops, turns out I fell in love with my psychiatrist. Okay. That's what he did. He listened, but he listened too much.
And this is really when he should have transferred my care, but you know, he waited. He liked what I gave him too much. And so even though my boyfriend did not meet my needs, my psychiatrist and my therapist both were like, you have to stay with him. There's nothing wrong with him not meeting your needs. I'm like, okay. And my psychiatrist was like, he's perfect. Don't get wrong with him. And what was perfect about him was he wasn't meeting my needs. So I was still coming to my psychiatrist looking for emotional validation, which he would drip to me slowly.
What?
So my therapist, who I didn't know at this time had bad boundaries, but she did, I went to her because my boyfriend and I, after like more than a year together, we started having issues in the bedroom. And so I went to my therapist and she asked me, what does your psychiatrist think about?
Yo, she's so messy. She is just, everybody involved is a problem. Psychiatrist like, please, I'm so glad you finally found someone who's putting up with your shit. Please. I've noticed that you actively stopped saying wild stuff. This is great. Stick with the guy all the way. As long as it goes, please. Please be nice to her. Oh my God. Let her cook. She doesn't know. Shaking my damn head. I'm trying to be nice.
This. And I said, I don't know. I haven't talked to my psychiatrist about this stuff because I have a crush on my psychiatrist and I don't want to tell him this intimate of stuff. And she said, well, you should tell him because I want a male's perspective. So at my next appointment.
Yeah, by the way, the big reveal in the last part was that she's been wearing these glasses because the psychiatrist one time said, oh, I like these glasses. One time. I don't even know how many years ago. Okay. One time, the psychiatrist, not even the therapist, the psychiatrist said, oh, I like these glasses. And she says she's wearing them with the hopes that he sees it. 2022 or 2023 at this point? Oh my God.
With my psychiatrist, I told him, I said, today we're going to talk about my intimate life. And he said, oh, I said, yes. My psychologist, my therapist, asked what your opinion on it was. And I told her that I don't talk to you about this intimate stuff because I have a crush on you. And he looked down and smiled so big in that moment.
Okay, that's when he should have fucking pulled the ripcord. Everything past this point is like fucked up. I mean, all right. Where the fuck is Austin? Yo, is Austin here?
Smiled so big and I loved it. It's so gross thinking about it. And then I proceeded to give him 30 minutes of non-stop content about my intimate life with my boyfriend. And I actually recorded the whole thing because I was so excited about it. But now it makes me sick. I can't even listen to the recording. I've tried to start, but it's gross. Any ethical psychiatrist would have stopped me and said, Kendra, let's talk about your meds. Let's talk about your care. At this point, my meds were stable. And I was still seeing him every month. Yeah, that was a rough time. And it was pretty much his Christmas morning.
Motherfucker got mad at somebody, wanted him to play Battlefield because there's too much stuff going on in the world, and now we're watching TikTok story time. Yeah, dumb fuck. I got mad at someone at literally 20 minutes into my fucking Israel coverage, not at the end of my broadcast. Okay, but in any case, I can't continue for the time being because everyone is here. Well, not everyone. Fucking Austin is not here, and also Cutie Cinderella is making a song with Jason. So who knows if she's gonna actually be able to make it to the fucking podcast? But we're gonna do it anyway. All right. Part-time Piker is back again tomorrow. What part is that? No, we'll continue with that. Don't worry. We'll continue with that fucking story. Oh, I'm going to cover that. Love you guys. I will see you tomorrow. We're going to do an earlier stream than usual. I'm linking up with Rashida Tlaib tomorrow. Once again, Rashida Tlaib on the broadcast in person, live and alive from Chicago. And we'll probably start at like 10. And then I'm going to link up with her after her keynote speech at the DSA conference. And then afterwards, I'll be doing some IRL stuff, most likely. Hopefully I won't be able to